The 5 moments for hand hygiene. It's presented by Sheila Donlon, Infection Prevention and Control Nurse Manager at the Health Protection Surveillance Centre.
Hand hygiene is the single most important action that we healthcare workers can do to prevent infection. Many studies have proven that there is a reduction in healthcare associated infection when hand hygiene compliance improves. The 5 moments of hand hygiene were developed by the WHO in part to address this issue. They are the 5 essential times where hand hygiene must be performed at the point where we're delivering care to our patients. The 5 moments are: 1. Before touching a patient, 2. Before a clean or aseptic procedure, 3. After body fluid exposure risk, 4. After touching a patient, and 5. After touching the patient's surroundings. So now we're going to take you through the 5 moments for hand hygiene. Moment 1 is before touching a patient, to protect the patient. Harmful germs may be present on your hands from your contact with the environment as you went about your work. We want to get rid of those germs before we touch our patient. Clean your hands as you enter the patient zone and just before you touch the patient. Moment 2 is before a clean or aseptic procedure, to protect the patient from harmful germs, including the patient's own germs entering his or her body during these procedures. Hands should be cleaned immediately before you start the procedure when you're in the patient zone. Here the healthcare worker is preparing for the procedure. We saw her clean her hands before touching the patient. However, her hands will have picked up germs when she touched the patient or surfaces around the patient. So she must clean her hands again, put on gloves if necessary, and immediately begin the procedure. When gloves are worn for clean or aseptic procedures like glucometry, mouth care, insertion of catheters or phlebotomy, hands must be cleaned immediately before putting on gloves. Moment 3 is after body fluid exposure risk, to protect yourself, the healthcare worker, and the immediate environment from contamination from harmful germs. Immediately after the procedure and before touching a clean surface. Here the healthcare worker finishes a mouth care procedure, discards the waste, removes her gloves and cleans her hands immediately. Remember, wearing gloves is not a substitute for hand hygiene. Gloves must be removed along with other personal protective equipment immediately after a procedure or task where there is a risk of body fluids. Moment 4 is after touching a patient, to protect yourself and the wider healthcare environment from harmful patient germs.
Is everything else okay?
Clean your hands as you leave the patient zone and before you touch anything in the wider healthcare area. Moment 5 is after touching the patient's surroundings, to protect yourself and the wider healthcare environment from harmful patient germs. Clean your hands as you leave the patient zone and before you touch anything in the wider healthcare area. If you practice and remember to clean your hands at all of these 5 moments, you'll keep your patient and yourself safe.